The dark truth about the neurological disorder market. Profiting from suffering. Imagine a world where brain diseases are no longer a life sentence. That's the promise behind the rapidly evolving neurological disorder market. The stakes are high, the pace of advancement is astonishing, and the impact touches millions of families worldwide. But here's where the debate heats up. Are we doing enough to make these breakthroughs accessible to everyone who needs them? Or are we simply widening the gap between those with resources and those without? Introduction. Today's global market addressing neurological disorders is on a resilient upswing. This growing momentum isn't just a fluke. It's closely tied to demographic shifts as populations age, the rising incidence of neurological illnesses, and cutting-edge innovations in how these conditions are diagnosed and treated. Conditions like Alzheimer's, Parkinson's, epilepsy, multiple sclerosis, and chronic migraine are being thrust into the spotlight, largely thanks to increased public understanding, progressive government initiatives, and the relentless drive of the pharmaceutical and biotech industries to uncover new solutions. Key highlights. Treatments designed to target specific neurological pathways, known as targeted therapies and biologics, are now in heightened demand. For instance, consider recent advances in biologics for multiple sclerosis, which offer more personalized and effective options for patients. Telemedicine is revolutionizing how we access neurological care. Whether you live in a bustling city or a remote village, virtual consultations and remote monitoring are bridging the care gap like never before. Investment in neurodegenerative research is surging. Private and public funding arms are fueling relentless exploration into the secrets of the brain, leading to the discovery of new biomarkers and therapeutic targets. Devices that modulate or stimulate neural activity, think deep brain stimulators for Parkinson's disease, are capturing widespread interest, hinting at a future where technology partners more closely with the human brain. Backhand index pointing right. Curious for more data? Request the sample report. https://www.prophecymarketinsights.com/market_insight/sample/5940. What's powering this market? 1. Aging around the globe. As lifespans lengthen, so does the prevalence of brain-related illnesses, driving steady demand for novel treatments. 2. Awareness on the rise. Proactive screening, early diagnosis programs, and expanded access to healthcare mean more people are being identified and treated sooner. 3. Technology opens doors. Artificial intelligence, sophisticated brain imaging, and laboratory biomarkers are dramatically increasing accuracy in diagnosis and tracking disease progression. 4. Government support. From funding for pioneering research to policies that improve patient care, public sector backing is providing a strong tailwind. But here's the part most people miss. The journey is far from smooth. Challenges still loom. High costs. Advanced treatments and state-of-the-art diagnostics often come with hefty price tags. Is healthcare innovation only helping those who can afford it? Regulatory hurdles. Navigating approvals for new drugs and devices can be complex and time-consuming, potentially delaying patient access. Gaps in awareness. In low-resource countries, limited education about neurological diseases leaves many without critical care. Market breakdown. By disorder. The landscape spans Alzheimer's, Parkinson's, epilepsy, multiple sclerosis, migraine, stroke, and Huntington's disease, offering a window into the diversity and complexity of neurological health. By treatment. Treatments encompass a wide array from next-generation drugs, biologics, and small molecule medicines to advanced devices such as neurostimulators, alongside surgical options and comprehensive rehabilitation therapies. By end user. From major hospitals and specialized neurology clinics to research institutes and even home-based care, the reach is wide and growing. By region. This is a global movement with notable activity in North America, Europe, Asia-Pacific, Latin America, the Middle East, and Africa. Recent developments you should know. Artificial intelligence is making headlines with diagnostic tools that analyze complex brain imaging faster and more precisely than ever before. Home-based neurology care is expanding, making patient-centric support possible where individuals are most comfortable, their own homes. Groundbreaking partnerships between major pharmaceutical companies and top research institutions are forging new paths in drug development. Back into Next Pointing Right, see the latest insights in the full report. https://www.prophecymarketinsights.com/market_disorder-market-5940. Looking forward, what's next? Experts forecast a robust climb for this market leading up to 2035. Anticipate new treatment strategies, increased healthcare investment, and the rise of innovative biotech startups, all reshaping how neurological diseases are identified and managed. Precision medicine, which tailors interventions to each individual's biology and a focus on catching diseases early, are tipped to be game changers in the coming years. Analyst insight. Innovation in targeted therapies and breakthroughs in neurotechnology are setting a new benchmark in global neurological care. Organizations that can adapt to deliver solutions that are both affordable and easily scalable will be the ones to beat. Shweta Rasker, Business Development Specialist, Prophecy Market Insights. About Prophecy Market Insights. Prophecy Market Insights has established itself as an authority in market research, trusted by leaders across a multitude of sectors. With a seasoned team of analysts and deep industry expertise, they deliver trustworthy, actionable intelligence, helping businesses anticipate trends, capitalize on new opportunities, and stay ahead of their competitors. Whether it's tracking emerging market dynamics, sizing up growth potential, understanding the competitive field, or uncovering hidden opportunities, Prophecy Market Insights commits to research that empowers strategic decision-making. Now it's your turn. Do you believe the pace of innovation will make these advanced neurological treatments widely accessible, or will healthcare inequality continue to be a barrier? Are current investments enough, or should governments and industry do more? Jump into the conversation below. Your viewpoint could challenge or reinforce the future of neurological care. The brain tech revolution. Real innovations beyond Black Mirror. The revolution in brain technology has arrived, and it's not just a dystopian fantasy. When the term neurotechnology comes to mind, many might envision the unsettling headsets from Black Mirror that invade our most private space, our brains, or the cybernetic warriors from William Gibson's Neuromancer. While such fears are understandable, they can obscure the genuine advancements being made in neurotechnology that aim to tackle the long-standing medical issues associated with our brains. Over the last 18 months, brain technology has achieved significant milestones. Enhanced algorithms, miniaturized devices, and, most crucially, evidence that individuals can perceive tangible improvements in their physical well-being and emotional states. A brain pacemaker. Keith Krabiel has been fighting Parkinson's disease for almost 25 years. By 2020, as reported by Nature, the tremors were becoming overwhelming. That is, until neurosurgeons implanted Medtronic's Percept device in his brain. Unlike traditional deep brain stimulators that bombard the brain's movement control areas with a constant current, the Percept takes a more nuanced approach. It first listens for the beta wave bursts that signal a Parkinson's episode, and then responds with precise timing, much like a cardiac pacemaker regulates an irregular heartbeat. In the ADAPT-PD study, patients like Krabiel experienced smoother movements, reduced reliance on medication, and a strong preference for the adaptive mode over the standard one. Regulatory bodies in both the US and Europe have recognized its efficacy, granting it clearance for use. Because the electrodes activate only during symptom flare-ups, overall energy consumption is minimized, which extends battery life and postpones the need for further surgeries. Even better, since every Percept device shipped since 2020 is equipped with a sensing chip, the adaptive mode can be enabled with a simple firmware update, similar to how you would update your smartphone. Reviving dormant muscles. This year, researchers applied the same listen-then-respond principle to the spinal cord. In a pilot study published in Nature Medicine, scientists in Pittsburgh placed two thin electrode strips over the sensory roots of the lumbar spine in 3 adults suffering from spinal muscular atrophy. Gentle electrical pulses reawakened previously inactive motor neurons. Every participant was able to walk further, experience less fatigue, and, remarkably, one individual walked from home to the lab without needing to rest. Meanwhile, across the globe, surgeons at Nankai University successfully inserted a 50-micron thick stent electrode through a patient's jugular vein, positioning it against the motor cortex and connecting it to a sleeve that stimulated his arm muscles. This procedure required no craniotomy or intensive care unit stay, just a quick catheterization that enabled a stroke survivor to lift objects and control a cursor. The future of high-tech rehabilitation is moving towards outpatient settings. Mental health solutions from home. The brain is not merely a network of wires and muscles. It is also the seat of our emotions. In March, the FDA designated a visor-like headset from Pulviner Neuro as a breakthrough device for treating major depressive disorder. This device delivers alternating and direct currents, while an integrated algorithm monitors brain activity in real time, allowing clinicians to adjust the treatment remotely. This innovation brings hope to patients whose depression has not responded to traditional therapies, such as medication. Thought-controlled cursors and artificial voices. Cochlear implants, once a concept from science fiction, now enable over 1 million individuals with hearing loss to hear. This success has inspired a new wave of brain-computer interfaces, including those developed by Elon Musk's Neuralink. The company's first user, 30-year-old quadriplegic Nolan Arbaugh, shared with Wired that he now multitasks constantly, using a cursor controlled by his thoughts, regaining some independence lost due to a spinal cord injury in 2016. However, Neuralink's progress may not be as advanced as Musk often suggests. Arbaugh's device has faced issues, including some threads detaching from the brain, yet the potential remains promising. In terms of communication, new technologies are translating neural signals into text on screens or even synthesized speech. In 2023, researchers from Stanford and the University of California, San Francisco, implanted brain devices in 2 women who had lost their ability to speak, achieving decoding speeds of 62 and 78 words per minute, significantly faster than previous brain interface technologies. While this is still slower than the average natural speech rate of 160 words per minute, advancements are rapidly closing that gap. Navigating the ethical landscape. It's important to acknowledge that neurotechnology does come with its concerns. Brain signals could potentially disclose a person's emotional state or even their political preferences. Europe's new AI Act categorizes neurobiometric categorization, technologies that classify individuals based on biometric data, including brain information, as high risk, necessitating transparency and the option to opt out. In contrast, the U.S. Brain Initiative 2.0 is funding open-source toolkits to allow anyone to examine the algorithms behind these technologies. Moreover, we must consider the risk of inaction. Rejecting a proven therapy simply because it seems futuristic is akin to refusing antibiotics in 1925 because a mold-derived drug felt strange. While 20th century medicine focused on the chemical aspects of the body, 21st century medicine is learning to harmonize the electrical symphony within our skulls. When effective, neurotechnology functions more like a tuning fork than a hammer, gently adjusting each part back into harmony, then allowing the music of life to continue. Real patients are walking further, speaking more quickly, and, in many cases, simply regaining their sense of self. The current challenge is to ensure our fears remain proportional to the actual risks, while also keeping our minds open to the remarkable benefits that are already being realized. Revolutionizing neurology, the future of neurotechnology devices. The future of neurology is here. Groundbreaking device technologies are revolutionizing healthcare. Stay at the forefront of the medical tech industry with our expert insights, top company features, and latest news delivered straight to your inbox. Subscribe now https://www.medicaltechoutlook.com/subscribe and discover the transformative power of innovation. The neurological device revolution. New hope for millions. In recent years, the field of neurology has witnessed unprecedented breakthroughs, transforming the lives of individuals battling chronic pain, neurological disorders, and mental health challenges. From wearable stimulators to implantable neuromodulation systems, these cutting-edge devices are redefining the treatment landscape for conditions like epilepsy, Parkinson's disease, and depression. Breaking down barriers. Advancements in device technology and design. Manufacturers are pushing the boundaries of innovation, focusing on three key aspects: miniaturization, precision, and adaptability. One of the most significant leaps forward is in bioelectronic medicine, which harnesses the power of electrical impulses to influence nerve activity. Implantable vagus nerve stimulators, VNS, already proven effective in treating epilepsy and depression. These devices deliver targeted electrical pulses to specific nerves. But here's where it gets innovative. Non-invasive VNS devices are now emerging, offering similar therapeutic benefits without the need for surgery. Adaptive deep brain stimulation. Unlike traditional stimulators, these systems utilize real-time data from the nervous system to dynamically adjust stimulation levels. This adaptive approach has shown remarkable improvement in treating Parkinson's disease and essential tremor. Transcranial magnetic stimulation, TMS, evolution. Enhanced coil designs, coupled with machine learning algorithms, are optimizing TMS treatment for conditions like major depressive disorder. And this is the part most people miss: the potential for TMS to be used in conjunction with other therapies for even more effective treatment outcomes. Manufacturing innovations. The key to widespread adoption. Advances in manufacturing techniques are making nervous system regulation devices more effective, accessible, and patient-friendly. Patient-specific devices. Tailored for comfort, functionality, and therapeutic efficacy. These devices are setting a new standard in personalized healthcare. Flexible electronics and bioresorbable interfaces. Reducing the risk of rejection and enhancing long-term compatibility. These innovations are paving the way for more widespread adoption. The AI and ML difference. Smart neurostimulators can analyze neural patterns, predict disease progression, and adjust real-time therapy. But what if AI could also predict patient response to different therapies before treatment even begins? The possibilities are endless. Wireless power transfer and energy harvesting. Minimizing surgical interventions and improving patient convenience. These technologies are the icing on the cake for an already revolutionary industry. The future is now. Industry expansion and the path forward. As regulatory approvals become more streamlined, the industry is poised for rapid growth. But will this growth lead to more equitable access to these life-changing technologies, or will cost and availability continue to be barriers for many? We invite your thoughts in the comments below. With continued collaboration between medical researchers, engineers, and biotech firms, one thing is clear: nervous system regulation devices are on the cusp of transforming healthcare as we know it. Are you ready to see the impact for yourself? Subscribe to our newsletter for the latest insights and updates.